I'm going to start out talking to you about pet overpopulation and really what we see as the problem. We often refer to this quote by Dr. Scarlett about the condition of companion animals. But basically, it takes as many lives as no other disease or condition of companion animals takes as many lives as euthanasia. In fact, no other disease comes close. I think that there is a lot of information out there that kind of slides past us in our day-to-day lives that we don't realize about how many animals are actually dying every day, unfortunately, because there's just too many of them. A staggering statistic that we often refer to is currently there's approximately 4 million cats and dogs, or about 1 every 8 seconds that's killed in U.S. shelters every year. It's not the shelter's fault. Those shelters in our communities are safe havens for those animals that are out looking for homes, and they are resource centers that are so important to our communities. But they are doing a very hard job. They have way too many animals out there to try and find homes for, and there's not enough homes. And we're looking for those forever homes for those animals. And so about 20 years ago, there was a movement that was made towards trying to spay and neuter these animals instead of just having these animals reproduce, putting the animals down that didn't have homes, or trying to find new homes for them. They knew that they needed to come up with a better plan. How that statistic works for Washington State currently is that, and this is a rough estimate of about 75% of the shelters and rescues in Washington State have reported that they're still euthanizing over 25,000 cats and dogs every year. And so I think it's a little easier to understand how it impacts us, our state, and our communities when you bring it down to those numbers, because 4 million just seems like a huge problem. I had to put the gratuitous picture of Ninja Bob in here, and if anybody knows Alan well, Alan takes this kitty home every weekend. Alan has been involved with our organization since before I came along, and we adopted this cat from our wonderful partner organization, the Humane Society for Tacoma and Pierce County. We were looking for a wonderful clinic cat, and we had decided that we wanted to give a home to one of the cats that maybe just would blend in or be overlooked because it had something wrong. And basically what I told them was, I want an old, fat, blind cat. And they really didn't do a very good job. They actually did a pretty darn good job. They found me, he was young, but he only had 3 legs. And he had a back leg that was only partial, and the rest of that leg needed to come off. And it was going to be an expensive surgery. And so in traditional shelters, and he was just a gray tabby. There's a lot of just gray tabbies out there. And in a traditional shelter setting, people do not want to adopt a cat that already comes along with medical problems. And so they were concerned because they had this amazing cat. They wanted him to have a great home, and I was looking for something very specific. And so I had to tell Kathleen and her wonderful staff there what I was looking for. The cat had to exist in our clinic and be able to put up with all the dogs and cats and the noises and the medical equipment and the clippers and the vacuum cleaners and everything else that we have going on a day-to-day basis. So that's a tall order, along with the fat, old, maligned, maimed order that I put in. So they had contacted me and said, we have a cat for you. And I said, really, already? I think it only took a week. And they said, yes, you've got to come meet him. And so I went down with another staff member and interviewed Bob. And at the time, he was called Stimpy because of his gimpy back leg. And they were right, he was pretty amazing, very chill, nothing seemed to get under his fur. We took a dog in there and he just really didn't care about the dog, and so I said, yeah, please, let's give him a try. Took him down to the clinic, and he actually has become a spokesperson for the organization. We have been able to train this cat to walk on a leash. He goes to all of our events. He has a bigger wardrobe than I actually do. This is one of his many costumes. He is at the top of our organizational chart now, even above our board of directors, and he's the one that signs my time off requests. And he is a great example of a cat that perhaps might have gotten overlooked in our adoption floors on our shelter, in our shelter system, because there's just too many of them right now. And that's why we use him as a story, because this cat is amazing. And I was going to bring him today. We actually even have a stroller that he likes to ride around in, and so he is quite something. And anybody he knows how to high five. He actually has a bunch of different behaviors that he does for treats. And so he's a very special cat, and what our job is to make sure that all of those amazing special animals that are in the shelter on a day-to-day basis are not, the numbers aren't overwhelming, so that they get a great chance of finding their forever home. So really, I've talked a little bit about the problem that's out there right now, and I want to talk about the solution. We know that high volume spay neuter in an affordable way in communities is really the answer to preventing overpopulation. We began as a grassroots organization called Peninsula Spay and Neuter Project, and that was back in 2001. And the founders realized that adoption was not the only answer to finding all of these animals homes, that we needed to reduce those numbers down to make it reasonable for our shelters to be able to do their wonderful job. So we were based upon a model where we partnered with local veterinarians and we issued vouchers out into the public. We would go and the founders did outreach into the community by word of mouth, flyering, and they would provide a voucher to families that perhaps couldn't afford to go ahead and spay and neuter their pets otherwise. And they would take those vouchers into local veterinarians that participated in the program and get them spayed and neutered. Much of the initial efforts focused on feral cats. The founders had a special place in their heart for wanting to make sure that these community cats that were loosely owned or not owned were getting spayed and neutered so that they would lead better quality lives and not end up in our shelter systems where they're not adoptable. And so much of the initial efforts surrounded those feral cats. In 2002, because of the high volume of requests that came into them, they decided to go ahead and also start issuing vouchers for dogs, because people were saying, oh, I would like to be able to spay and neuter my cat without dogs. And the focus for a great many years became the most at risk. And that was the pit bulls in these homes, and the feral free roaming cats. Those are the most at risk in our shelter populations, especially at that time in the early 2000s. Feral cats just don't have the ability to be adopted out as a family pet. They really need to be managed as a community colony. And pit bulls, there's a lot of them in the shelters, and they are not often, unfortunately, the #1 choice for adopters looking for dogs because of public misconception. And so there was a great effort on making sure that there was an affordable spay-neuter option for both of those populations. So in the first 6 years, we accomplished 10,000 surgeries, and that's a pretty amazing impact for a grassroots organization that was all volunteer. And there's some statistics that talk about exactly how that broke out for the feral cats and the pit bulls. But we realized that this was not completely working out exactly how we wanted to make sure we could make the biggest impact that we could. Some of the veterinarians wanted to ensure that those pets had vaccines or were getting vaccines when they were bringing them in, and that was not the focus of the organization. We do realize that there is an important component for pet health that includes vaccines, but really our mission was focused on bringing the number of animals being born out in the public on a day-to-day basis, and so we wanted to make sure that all of that money was going into spay and neuter and not vaccine requirements. They also were reluctant or didn't have the skill set to do pediatric spay and neuters. Current medicine says that it's fine to do spays and neuters on animals that are 2 months and 2 pounds. And a lot of veterinarians didn't want to do it at that age or could not. They also get in your 100-pound fat pit bull that's pregnant, and they didn't want to do those spays either, and they can be problematic and difficult, take a lot of time, and unfortunately those are the ones that are really necessary to try and control that population problem. And they realized that these people may not be their return customers always, they had limited incomes, and so some of them stopped participating in the program. So we realized that we needed to do something to continue the program and grow it, not see it diminish. We had heard about an organization back in North Carolina called Humane Alliance. And Humane Alliance is a high volume, high quality, affordable service that's offered in North Carolina. And they have been very successful in creating a program that embraced all of those qualities. And what they ended up doing was, because they were so successful at reducing the numbers of animals that were being euthanized in their local community through this prevention for overpopulation, that they started teaching others how to do it. And we had, the founders of the organization had heard about them, and so they went and talked to them about perhaps bringing a clinic to our local community. And we had to apply, and we were accepted based upon the population and the support that we have in the community. And we, the founders went back and learned basically how to put together a clinic here in Washington State and specifically Tacoma. And we did some fundraising with some local partners, animal welfare organizations. Again, the Humane Society for Tacoma Pierce County has always been one of our partner organizations, and they were very key to helping us get our clinic up and running. And in March of 2008, Coalition Humane was born. And the impact of that clinic was immense. Where we had done 10,000 surgeries previously in those 7 years, from March of 2008 to May of 2010, we did another 10,000 surgeries. So having an actual brick and mortar facility that people could walk into with their animals, and we did have the prerequisite for vaccines, and we had somebody, it was somewhere that they could physically go to, one location that was centralized, made a huge difference. And that was actually our 10,000th dog right there that was part of the Cinderella program. They were partnered, so that is another way that we partner with the Humane Society for Tacoma Pierce County, is that we accept their Cinderella vouchers at our clinic, and they happen to be part of that program. What we realized in about 5 years of having that clinic there, it was a little earlier than that, our lease was going to expire at the end of 5 years. And at about the 3.5-year mark, we realized that we were quickly outgrowing our small little space. We were in 2,300 square feet there, and it was a leased facility, and we knew that it was not going to continue to grow with us. We needed parking, we needed closer accessibility to the highway, we needed more space. And so we started looking in the community and doing some fundraising, and because we had been so previously successful through the years of being able to spay and neuter those animals, we generated continuous support from the foundations and businesses and local individuals in the community, and were able to fundraise the money in a fairly short amount of time, about 1.5 years. And a new clinic was born and a new name. We realized the Coalition Humane, even though it was a pretty cool acronym, was not doing us very well. People were very confused about what we were doing. And so we tried to simplify it for our community. And so we don't think that we can get much clearer than Northwest Spay and Neuter Center. We used to be right up here on the hill on 21st and Tacoma Avenue South, and now we are over on Pacific Avenue, right across from Welcher's Gun Shop. That seems to be a community icon that everybody knows and is familiar with, so we just throw that out there. It's a very large building. We're 7,800 square feet now, and we have the capacity to do 30,000 surgeries every year. Wow. Our mission focuses on affordable, high-quality spay and neuter services for cats, dogs, and rabbits. We also do rabbits now. They are the 3rd largest companion animal population that is growing in the United States, and we realized that there was need for those animals out there too. And so we wanted to start providing that service to the community, and we were surprised by how needed it was and has been. And that is in an effort to stop the killing of animals due to overpopulation. At that time, and only at that time, we can offer microchipping, vaccines, and parasite control. We do not do any follow-up care for animals after they come in. Again, we still continue to embrace our mission of reducing the number of animals out there to try and stop the killing due to overpopulation, and so that has always been our focus and will continue to be the focus as the need still remains. We are a 501c3 nonprofit organization. We don't receive funding from any other organization. We are not part of any other organization. So who can use our facility? We tell anybody can use our facility. Obviously, we have a focus on the low-income individuals in our community that cannot afford to spay and neuter their animals or will not spay and neuter their animals because of the cost. And as well as the homeless animals in our community, we partner with a great number of animal rescue groups. Currently over 65 in the state right now bring their animals to us to be spayed and neutered. And we also offer services for the 2 shelters, local shelters in the region, the Humane Society for Tacoma and Pierce County. We actually do all the spays and neuters, well, 98% of the spays and neuters for their organization, so that they can better utilize their funds and use their money. Because we're so efficient at what we do, we can do it more efficiently and cheaper than what they could do in-house, and so they can better use their funds to care for those animals. And then Mentor Animal Services over in Puyallup. And for those individuals in the community that don't have the means to even afford our low prices, we always have subsidy programs running. And for the feral cats in our community, we now offer our catnip package of services for free. So if you have community cats in your area that need to be trapped, brought in, we can spay and neuter them and offer them some other care for free of cost. Our prices start at $35, and that typically, that is about 1/3 of what traditional veterinary costs for spay and neuter run. The top price that you would pay for any animal to bring into our facility is $125, and that's for a female dog that's over 100 pounds. And so you could bring me a 180-pound Great Dane, and it will only be $125. So, and typically it's something like that would be somewhere around $700 to $800. So you can see that the cost savings is substantial, and really is. What we have learned through history is that people want to do the right things. They don't want to have those puppies and kittens looking for homes, but if they can't. I'm back. But if you are trying to put gas in your car and food on your table, then that is not the highest priority. But so if we can make it reasonably affordable, or even free if it's necessary, they will do the right thing and make sure that those animals are cared for. Because we're a nonprofit, we only charge what it costs to operate, and so we keep our costs very low. And 91 cents of every dollar that's donated to our organization goes back into directly supporting our programs, which is pretty phenomenal for our nonprofit, because we are able to be very efficient with our fees for services. Grants and fundraising help cover the cost for those special programs and the subsidy fees that I was talking about. We perform on a day-to-day anywhere between 50 and 70 surgeries, which is typical veterinary clinic does probably 2 to 3 a week. And so when we tell people we do, typically, well, yesterday we did 64. So that gives you an idea, and we do that typically somewhere, we start at about 9 o'clock in the morning, we finish up about 3. We had, in 2013, as of yesterday, we have performed 11,006 surgeries. So that's very exciting to think about all of those homeless animals that we've prevented through those surgeries, and the services that we've been able to offer to our partner organizations and the individuals in our community that we need to help. And just as a standing clinic doesn't include the 10,000 that we did previous to that, we've done 47,161 sterilization surgeries. So one of the amazing things that we like to, that we like to talk about is we know that our work actually makes an impact on the numbers that are the intake numbers in the local shelters. our partner at the Humane Society for Tacoma, Pierce County, has been able to report that since 2008, when we opened our first clinic, they've seen a decline of 40% in the intake of the actual euthanasia of healthy dogs and cats. And we're hoping that they actually don't have to euthanize dogs anymore because of homelessness, and they are getting very close with the cats. So we're really excited to be able to help in that way. This is some of the quotes that we've had from the people that have been able to use our facility. Oftentimes in the communities, we have questions about, do we use licensed veterinarians? Of course, we use licensed veterinarians, and not only are they amazing veterinarians, but they're actually experts in what they do. They are an expert in spay and neuter surgeries, and that is why they are able to perform these surgeries where these incisions are itty bitty. We have other veterinarians ask us if we actually take all the parts out, because they can't imagine that that would happen in that small of a surgery site. And because we are so quick at what we do, because we are efficient and that's all we do, the recovery period for those animals is much lower, and it takes a lot less time for them because they're under anesthesia for a lot less time. If you ever have had surgery, you know the longer you're under anesthesia, the harder is your recovery, and so it's the same thing for our companion animals. And we hear every day, which really is a wonderful piece for us of appreciation from the individuals in our community for the service that we offer. And here's some of the faces of those that we've helped in our clinic, and we're very fortunate to be able to do so. And each of those animals has a specific story behind it, but the one that I always think of is Mr. Cat up there on the left-hand side, and he was a community cat that had a caretaker, and she had about 15 different cats that she was caring for in her neighborhood. And through our facility, she was able to make sure that all of those cats were spayed and neutered, and we were really appreciative to be able to help her. Is there any questions? And also, I did leave on each of the tables some flyers, some information about the different programs that we offer, and then also we have our annual auction that's coming up in March, and there's some save the date cards there. So I'd be happy to answer any questions from you.